Assalamualaikum. My name is Nurailan Natasha binti Mat Taib. I'm going to answer the practical test. For the first case study, it's about a 22-year-old male patient having an intermittent lateral left shoulder pain, and then occasionally it referred up to the upper part of the arm. And the main complaint of the patient is that he is unable to lift a 5 kilo dumbbell, which indicates muscle weakness probably, and then sometimes pain in the morning, which indicates inflammation at the shoulder region, and then pain at the end of the day after coming back from work, which means that the pain is from accumulation of movement during the day. And also patient also complained that there is popping movement, popping sound or sensation during certain movement in daily activities such as combing hair, brushing teeth, and also putting on jacket. Alright, so I'm going to do a motor control assessment since this patient is having a lot of pain together with certain movement in daily activities. So this motor control assessment is called as hand behind back. Alright, so I'm going to demonstrate first the test. It's going to be something like this. So you're going to put your hand behind your back and reach as far as possible going upwards, okay? So in this test, I need you to take off your shirt so that I can properly assess your back, alright? Alright, so we're going to start with the left side first. So what we're going to assess in this position, okay, can you turn around? Alright, turn around again. Alright, so this is the back of the patient. So what we're going to test when patient is doing the hand behind back, alright, can you put your hand behind your back? Alright, so the first thing that we need to observe is that the wrist, whether it can reach up to approximately the T10 level of the spine. So we just approximately, this is the C7, so we count up to T10 level, so around here. So if the patient is unable to reach up to these levels, and then we ask why you cannot reach to that level, is it because of pain? Yeah, so that means the restriction is due to the pain, so we call it as antalgic restriction. Alright, in this position as well, we need to confirm with the right side first, so that we know that if the patient is really having the difficulties, or that is the normal position of the patient. Okay, can you perform the same test on the right side? So it can reach up, it can reach further compared to the left side. Alright, thank you. Alright, now let's go back to the left side. So after we see the position of the wrist, and then next we have to see the scapular motion. The scapular motion, the patient should normally be able to maintain its scapular motion in its neutral position, and it shouldn't be held against the chest wall. Alright, so if a patient is unable, the scapula is unable to held in that position, it can indicate two things. The scapula may be winging. So if the scapula is winging, it indicates there is a weakness of the anterior muscles. And then another thing is that if there is the scapula may be excessively downward rotated. So if it is downward rotated, it indicates there is a weakness, tightness of the levator scapula and the rhomboid muscles, and weakness at the middle to lower trapezius muscles. Alright, so next, this is the back position, and then we also have to observe from the side view. So what we need to observe from the side view is that the humeral head of the patient. Okay, so in this patient we can see that the humeral head is moving slightly forward. So if it's moving slightly forward, it means there is a tightness in the glenohumeral capsule, the posterior of the rotator cuff muscles, and probably tightness at the long head of biceps muscles as well. Alright, and then in this position we also have to assess the spine, the cervical and thoracic spine of the muscle. So in this position, in this patient, we can observe that this patient is having a forward head posture. So if patient is having a forward head posture, meaning that there is a tightness at the suboccipital muscles and weakness at the deep neck flexors. Okay, and then we can see that supposedly this patient is having an increased kyphotic posture. Okay, so this indicates that the patient is having a tightness at the pectoral muscles and weakness of the rhomboid muscles as well. Okay, so overall, this patient may probably having a impingement syndrome of the shoulder or the rotator cuff muscles, but in order to confirm the diagnosis, we have to do a further special test for the shoulder. Okay, and yeah, so probably this patient have a shoulder impingement syndrome. All right, so moving on to the thank you. So can you pakai balik? So moving on to the second test, which involves a 23-year-old male patient having pain at the posterior of the right knee, and the pain is 1/10 for the visual analog scale. Okay, so the main complaint for this patient is that during resting there is no pain, and then but the pain aggravates when patient is doing kicking the ball for several times. So kicking the ball meaning the motion of the knee is in knee extension, but the pain is at the posterior of the knee. So upon palpation at the back of the knee with the deep palpation, there is a tenderness and pain as well. Okay, so we are going to find out what are the correlation with the pain at the knee, at the back of the knee, and the movement of knee extension. So the test what I'm going to do is the alternate knee extension test and dorsiflexion. So what I'm going to instruct the patient is I need you to lift up and straighten up your knee as high as possible, your right side, okay, and then hold it for 5 seconds. All right, so what we're going to observe in this position, firstly, is hands at the side, is the rotation of the knee. All right, now can you lift up your knee up straight and hold it? 1, 2, 3, 4, 5. All right, down. So we should observe if there is a medially rotated of the knee. If it is medially rotated, meaning there could be tightness at the distal hamstring muscles and also tightness of the pes anseris group of muscles. Okay, and then next one, when patient is doing knee extension, what we also have to see is the range of motion of the knee. All right, can you lift it up again? All right, stop. Okay, so we can see that there is a lack of knee ROM, which indicates the tightness of the hamstring and also weakness of the quadriceps. All right, and then together, when I ask the patient to do ankle dorsiflex, all right, can you push up your foot? All right, so we can see that there is a tightness as well in the dorsiflexion as patient unable to do the full range of knee of ankle dorsiflexion, which indicates a tightness of the calf muscles. So how do we know? We have to assess using goniometer to assess the full range, and also we can compare to the left side of the knee. Alright, can you? Yes, thank you. So see, this is much better with the full range of the knee, and then can you lift this one up and full range of the ankle as well. Alright, thank you. Okay, so another thing is that we have to assess during this knee extension test is that when patient is doing the knee extension, we have to observe the spine. Alright, can you lift hands at the side? Alright, can you lift up your legs up? Okay, so alright, straight. Alright, so we can see that this patient is having difficulties with fully extending the knee. Alright, thank you. Put down. Is that the patient is trying to attempting to do a slump position. So when patient is put in slump position, okay, bengkokkan badan. Alright, thank you. And then lift up your legs, and the knee range increases. But when increase the lumbar lordosis straight up and then extend the knee, there's a limitation in the knee range, which indicates the hamstring tightness. So when it has involved up to the lumbar of the spine, especially particularly on the lumbar position. We want to see again how does this muscle on the lower limb correlates with the spine. So we are going to do the bridging test. All right, can you lie down with facing up? Okay, so this is a bridging test. So this bridging test will see whether the patient is having a tightness on certain muscles and also weakness on certain muscles. This bridging test is going to be it will be done progressively. So the first one is that knee flex, both knee flex. Okay, knee flex should be approximately 120 degrees and the knees should be flat and pelvic width apart. Alright, hands at the side. Alright, the first step in the first test for this bridging is that I need you to lift up your buttock as high as possible and hold it for 5 seconds without holding your breath. Can you do that? Alright, ready and up. Alright, good. 1, 2, 3, 4, 5. Alright, good. So what we need to assess in all the bridging tests is that the position of the lumbar spine, it should be in neutral position. Okay, now that is the first step in bridging. Now the second step in bridging is that I need you we have to increase the resistance by reduce the so we're going to ask the patient to cross over both of the hand over the chest and then lift up the buttocks again for 5 seconds and up. So we have to observe whether the lumbar are able to maintain in a straight position for 5 seconds and down. Alright, and then the third one, hands at the side, we're going to do a single leg bridging. So what we have to observe in the single leg bridging, the thigh level should be at the same level as the one lifted. Okay, so I need you, for single leg bridging, I need you to lift up your buttocks and then straighten one of the knee up. Alright, and hold it for 5 seconds. So are you ready? And go up. Alright, good. 1, 2, 3, 4, 5. Alright. Okay, so that is the third one. So we have to assess the bridging, the lumbar position, and also the level of the thigh muscles, and if the patients are able to hold it for 5 seconds or not. And then the next one is that we single leg bridging, but you have to start with your legs on my shoulder. Okay, so start on this one. Okay, so same thing, bridge up and go. 1, 2, 3, 4, 5 and down. Alright, good. Alright, how do you feel so far?
Good.
Okay. Alright, now with this one, like I said before, all the bridging tests, we have to assess the lumbar position, whether the patient is able to maintain in a neutral spine. Cannot be there shouldn't be any increase in lumbar lordosis, or if the patient is suddenly experiencing cramping, that is an obvious indication of a hamstring tightness. Okay, alright, now the last one for the bridging test is that we have to do the bridging, okay, but when you go up for 5 seconds and then when you go down, I need you to immediately go up again. So that is the catch while doing the bridging. Alright, so bridge up 5 seconds and go down and catch up. Alright, can you repeat that for 2 times? Okay, ready and go. Bridge up, 1, 2, 3, 4, 5 and down and up. Yes, so it has to be immediately go up. So we can repeat that exercise for 5 times straight, and then rest, and then continue for another 5 times. Alright, so the indication for this test, if the patient is unable to do hold this bridging test for 5 seconds, or if the patient unable to do this bridging test progressively accordingly, that indicates a tightness can be in the hamstring muscles, in the tightness in the hamstring muscles and the calf muscles, and also it could be there is a weakness of the gluteal muscles as well. Alright, In terms of treatment, we also have to do the same thing, but in repetitions and holding progressively. Alright, okay. So overall, so it could be that this patient is having a hamstring tendon pathology as well. Alright, back in the alternate knee extension test, is that the alternate means that the patient has to perform the test left and right accordingly lah, so that we can compare the left and right position. Right, so that's all from me. Thank you.